Hi guys, and welcome to another webinar hosted by Med School Coach. Today we're going to be talking about how to stand out on the awards, advice from attendings. Thank you again for joining in with us. Let me introduce myself real quick before we get started, and then we'll get rolling. I'm going to try to keep this presentation relatively brief just so we can get through the content and then hopefully stimulate some good discussion on the topic too. So my name is David. I'm a family physician. I'm the Director of Residency Advising with Med School Coach. I'm also an Associate Director of Advising for our pre-medical work. When I made this slide, I was still an active duty flight surgeon with the Army. Now I've transitioned over to the reserves and working in a civilian capacity as a rural family physician up in the mountains. So let me tell you a little bit about what we're going to discuss, and then we'll just jump right into the content one by one. So I really want to talk to you about a couple of things here, so let's just lay it out. First, we're going to talk about, what is third and fourth year? What are the clinical rotations? How are they structured? I know there's a lot of different listeners out there. Many of you guys are pre-meds and will find this useful, and some of you are just going into your clinical years. So we'll just go all over that. Let's talk about some ways to set goals so that you can make your clinical rotations useful, educational, and maximize the time you spend on them. Then we're going to talk about how the shelf exams play a role in your education and each rotation. And then lastly, we'll talk about how to really get the most out of every single rotation, how to really make the clinical years impactful for you. So let's first talk about just what third and fourth year are. So schools will kind of break this up into two large groups of way they structure these. Is that there's the traditional block schedule, which is actually how I was educated. And then there's the longitudinal curriculum, which is actually how I was teaching previously. Let's take a look at what these actually look like, and we'll talk a little bit about the pros and cons of each one. This is a sample of what a traditional core block schedule might look like. So this is basically doing one rotation at a time. So you're going to spend time on internal medicine, start it, stop it, then move on to the next rotation. There's some pros and cons to this, and it's kind of nice to compartmentalize your education, your studying into one specialty at a time. You'll find that the big core rotations like internal medicine, general surgery, stuff like that, take up these massive blocks of time, while some of the smaller things like OBGYN take up smaller blocks. And this is kind of a nice way to structure it. It makes it easy to understand, easy to follow. The downside here is that, well, you don't really start to learn how each specialty plays into one another. Also, if you take a look at this screen in particular, the things you learned on surgery, you can't apply backwards to what you were doing in internal medicine. Certainly you can apply things forward, but there is an element of kind of not being able to use what you learn on each rotation you want to apply to the next. Another kind of schedule is this kind of longitudinal curriculum. This is how I was teaching students. My students would be rotating with me throughout the week, throughout the month, while they were also rotating on other services. So you can see on this sample schedule that sometimes you're switching specialties within a day even, and then you're coming back to it sometimes in the week, sometimes the next week. But basically you get to kind of rotate through all of them throughout the year. This makes it a little bit more difficult for studying for shelf exams because you have to be studying for a lot of different things all at one time, and those shelf exams are kind of spread out. We'll get more to shelf exams in a little bit. The benefit that I see here is certainly that what you learn on IM in one day, you can apply to psychiatry the next and vice versa. And so there's a nice mix of how you actually learn and apply concepts as you go through the curriculum. So just, a couple of ideas of, the pros and cons here. Ultimately, if you're in medical school, I wouldn't be too concerned. You're going to be able to learn very well in each of these. If you're a pre-medical student, you might think about, school choices based on how their third and fourth year are set up. Ultimately, there's no right or wrong way to learn here. These are just how your clinical years will be set up. So now let's talk about how to set goals while you're on these rotations. And I think this is very important. We're going to talk about some key concepts here because I don't want to just show you what a goal looks like. I want to teach you how to make those goals. So we're going to find that we're applying similar concepts with each of the goals that we create. So I'd like you to keep a narrow target window. The more generalized your goal, the harder it is to keep track of it and the harder it is to track your progress in it. Consider the length of the rotation when you make it. the goals you set for a 4-week rotation are going to be a lot different than a 12-week rotation. So just take that into account. It's very important to establish a mentor early on, and that can be anybody that's established and you feel like can train you well. So probably not an intern, but depending on the year, maybe the interns are very strong, but at least, a second or third year resident that you've shadowed and spent some time with and understand they've got a good approach to patient care and good knowledge. Certainly, fellows attendings are probably the easier ones to select here, but may or may not be more busy. Once you've got your mentor, you want to make sure that you're soliciting feedback at regular intervals, and that's how you actually keep track of your progress. So let's take a look at a sample goal to just put these principles into effect and show you how you can actually build a goal for your rotation. So let's say that we're on internal medicine and we're going to be looking at like an 8-week rotation here. So let's choose a very narrow target here. Let's say, okay, we're going to practice improve medical history taking and physical exam skills. Now, certainly you're going to want to learn a lot more than just these 2 concepts on your rotation. But again, we're just giving an example of how to build some goals, and you can make as many goals as you want during your rotation. But again, for each goal, try to make it narrow and individually focused here. Okay, so now let's talk about how we're going to plan this out in terms of the timing. So let's say we've got an 8-week rotation. We're going to take 4 weeks to work on history taking, 4 weeks to work on physical exam. Okay, so we've broken it up into nice bite-sized pieces. Now we need a mentor. So let's identify a seasoned resident. Let's say it's a 2nd-year resident. And we're going to observe and learn from that resident, and then we're going to ask for feedback. Let's plan our feedback solicitation. So let's say that we spend the first week identifying a mentor. On the 2nd week, you can start to identify that, hey, here's the goals that I want to work on. So let's say, hey, for the first 4 weeks, I really want to work on developing my medical history taking. So you're going to tell them the goal that you have. You're going to go practice that goal. And then in a week or 2, you're going to come back and ask for feedback. Hey, how am I doing? They're going to tell you, okay, you're doing good on this. You need to work on this. And then you can take that feedback, apply it, then come back in a week or 2 and ask for more feedback. It's that back and forth, developing a goal, checking your progress, and coming back and refining it. That's how you really improve your clinical skills. So whether it's history taking, physical exam, or it's procedural stuff, just make sure that you identify the goal, work on it, come back. And if you keep checking in, that's how you don't build bad muscle memory, and it's how you develop good habits and techniques for your clinical skills. So hopefully that gives you an idea, of at least just a general principle on how to set some goals, and an example of how putting that into practice. Writing this stuff down, putting it in a notebook is a great way to keep track of it, and you can just tick off the goal as you go. So that's setting goals and getting into that kind of stuff. Let's talk about this shelf exam. So there's a few things that you probably need to know about shelf exams. And most importantly, you got to know that this is going to differ from school to school and from rotation to rotation. So just make sure you're checking in with your school to make sure you understand how these how they actually play into your grading. So for many schools to receive honors or an A or whatever their highest mark is, you usually have to do very well on the shelf exam. The bulk of your grade for the whole rotation often has the shelf exam does play heavily into the weight of that grade, so just check in on that too. That is to say that you'll notice that even sometimes your peers that don't do so well in the clinical rotations part of things, they may end up doing very well in the rotation overall if they just do exceptionally well in the shelf exam. So just check in to see what your school does and how it splits up the grading there. Now, let's talk about some positive attributes here, is that shelf exams are like practice tests for your Step 2 CK or your COMLEX Level 2. So use these as a good gauge of how your progress is going. While you're studying for shelves, you can consider it kind of free studying for the Step 2 or COMLEX Level 2. So take that into account. And just use it to gauge your progress. If you're not doing well on them, then maybe you need to work harder or refine your study techniques, because you know you're going to need that when the licensing exam comes up. Now, this last point, I want to make a very big point of stating, because it's important to me as an attending physician, is that the rotation is not the shelf exam, and the shelf exam is not the rotation. Like I had said before, you'll find some of your peers putting an extraordinarily large amount of time into studying for their shelf exam, And they may or may not be putting an equal emphasis on the clinical skills portion of it, basically the day-to-day stuff in the rotation. They may or may not do well in the class, but that's not the important part here, is that your clinical years are designed to make you a good doctor. And remember, I guarantee you didn't write a personal statement on being a master of standardized tests, is that you wanted to provide compassionate, empathetic, high quality care to patients to change their lives. It doesn't really happen from studying for shelf exams, although you do learn stuff from it. The key to being a good physician at the bedside and actually making a difference in your patient's life is the stuff you're learning in the day while you're in the clinic or the hospital or the OR. So I just want to set some healthy perspective here, is that it's very, very important to pay attention and play an active role in your clinical rotations, not just the studying for the exams. Now, having said that, we understand they are important and they do contribute to your grades, which then contributes to your ability to get into residencies and programs and stuff like that. So be honest with yourself. For most applicants, by the time they've taken by the time they've got into their clinical rotations, they've already taken step one. So you know how you're going to react. Just 1 second here, I'm going to pause this. Sorry about that, just wanted to eliminate any background noise that was going on. So by the time you've entered your clinical rotations, you probably will have taken your step 1 exam or your COMLEX level 1. That means you've got a pretty good understanding of how you deal with standardized tests. So be honest with yourself when it comes to the standardized testing of your shelf exams. If you needed help, if you needed tutoring, if you found some different resources that you needed beyond your school's curriculum to succeed here, remember that, okay? Don't just try to wing it. Use what you've learned already in your first and second years in terms of your studying ability, motivation, and stuff like that. If you need tutoring, if you need help, there's certainly services out there beyond your school's curriculum to help you with these clinical rotations and your shelf exams too. Okay, on to the next portion. This is where I really want to focus our attention here. So I really want to spend some time talking about how to maximize your performance and really make the most out of your clinical years, because this is what's important to me as an attending physician. So I don't have any fancy slides for this one, so I just want to open this up for a discussion here, is that we're going to talk broadly about passive versus active learning and then hit some of the key points on this slide here. So this is really what helps you, set you apart in terms of gaining clinical knowledge, which is good from a career progression standpoint, but also it's important because this is really the point of your clinical education. So the first thing I want to talk about is comfort versus discomfort. Now, you're going to be in groups, rotating through the hospital, rotating in a clinic, and it can be very uncomfortable, right? Let's say you're on internal medicine and you're with the fellow, the attending, upper level medical students, and you've got nurses and everybody around you in this big setting. It can be very uncomfortable being the bottom of the totem pole, knowing the least about the material, and then often getting questions about that material as you go. It can be really easy to stand in the back of the crowd. It can be easy to avoid questions, but take a moment to think that, as you go through your rotations, ask yourself, do I feel comfortable or uncomfortable? And I'm going to challenge you that if you feel comfortable, then you need to push yourself more. You need to be in a constant state of discomfort, because that's where the learning occurs. So like I had said, you're going to be in these groups. It can be easy to stand in the back. It can be easy to avoid eye contact with the attending while they're asking questions and talking about patients. I want you to step to the front. I want you to get involved. I want you to make eye contact with people, and I want you to be vocal. That's where learning occurs. And it also will make you more uncomfortable, which again puts you into a place of learning. Now, in that setting, you may have heard about, quote unquote, pimping in medical school, which is the proper term for it should be the Socratic method of teaching, which is supposed to be a dialogue. That's what the Socratic method is. So it's supposed to be a series of questions and answers to stimulate discussion, and for the teacher to understand what the learner knows, and for the learner to establish and understand what they don't know, so that they can identify learning goals. Now, some attendings are very good at this and doing it in a non-confrontational way, but unfortunately there's some out there that use this Socratic method as a chance to use rapid fire questions and, grill you on esoteric material, which may or may not be relevant. You just need to roll with it. The more you participate, the more you can actually learn from it, even if it's not necessarily pleasant. Now, I usually make a note of this when, beginning a rotation with my own students to let them know, hey, I'm going to ask you a bunch of questions here. The purpose is not for me to put you on the spot or make you feel uncomfortable. I'm asking questions so that you can show me what you know, so that I don't actually teach you the stuff you already know, and for me to identify learning gaps so that we can both fill those gaps in knowledge. So, okay, it's easy to try to get out of this, but there's a really good phrase I want you to learn to know when it comes to the Socratic method is get very comfortable with the phrase, I don't know. Now, you don't want to spend all day saying, I don't know. That probably means that you're not doing enough studying. But the important part here is that when you're getting asked questions by patients, nurses, other staff, attendings, it is not okay to make stuff up. Now, as physicians, we try never to, BS our way through a question or make up a response. If you don't know the answer to a question, it's totally okay to say, I don't know. That comes in very handy when you're on rounds. If you get asked by an attending and you don't know the answer to it, you may feel compelled to try to make something up, which then makes for a bad learning experience. Nobody learns when you're just trying to pull stuff out of thin air. So if you can get comfortable with just saying, I don't know, it allows the learning process to continue. The attending will ask somebody else, or they'll just fill in that answer themselves so that you can learn. What I do want you to remember is that as you go, as you're saying, I don't know, I want you to make a note wherever you're doing it on a digital format or just old school pen and paper, put an empty little checkbox and write down the question or the topic that you don't know the answer to. By the end of the day, you should have a long list of things that you don't know about from that day. Before the day is done, and this is the way to consolidate your knowledge, go back one by one and look up the stuff. So it may be as simple as, what is COPD? Go in there and make some notes there. And I want you to actually write it down there too, because looking things up and writing them down helps consolidate the knowledge in your mind. That's how some learning works here. So look up the answer, write it down. You don't have to write a whole paragraph or an essay about it, just some notes. That'll help consolidate the knowledge before you move on to the next day. Because the next day, you're going to find that you're writing down a whole long list of things again. It's okay. You'll notice that sometimes you're writing down the same question day to day. But as things go on, that should help consolidate your memory as you kind of learn and relearn the same things over and over. That's a great way to stay organized in your clinical rotations so that you can get out there, get uncomfortable, and learn from the actual process of rotating and going on rounds together or seeing patients with the attending. Consolidating your knowledge by writing the things down that you don't know and then looking them up later. And that's going to start to improve your clinical knowledge as you go. So I know this was a relatively brief webinar today. What I hope you've learned from this is a little bit about what third and fourth year look like, how to develop some goals so that you can set yourself up for success and make a strategic, well-organized plan to learn in an organized fashion. And then how to actually learn on those rotations by studying well for your shelf exams and then getting yourself out there and learning, engaging with the environment you're in. So thank you so much for joining us on this webinar. I'm going to open it up to questions so we can field some of those, and I hope you'll join us on the next webinar. Thank you so much.